Every day, like every senator, I get mail from men and women across my state. And I can tell you that on no other issue have the letters that my constituents have sent me underscored the urgent need to act more than healthcare nightmares that they've shared with me. For example, Lisa lives in Gardnerville, Nevada, a beautiful place, Mr. President, right under the Sierra Nevada mountains. It's really scenic and beautiful. She lives there in Gardnerville with her two daughters. One's 10 and one's 7. The youngest little girl suffers seizures, and her teachers think she has a learning disability. Because of her family history, Lisa, the mom, is at high risk for cervical cancer. Though she's been told by her doctors that she should get an exam every 3 months, she now goes once a year because she doesn't have the money to go every 3 months. When Lisa lost her job recently, she lost her health coverage. Now both Lisa and her daughter miss out on the tests and preventive medicine that keep them healthy. Her long letter ended with the simple plea, and I quote, "We want to go to the doctor," end of quote. Braden lives in Sparks, Nevada. The 55-hour weeks he works to support his family just barely covers his bills. He doesn't have enough money to buy health insurance for his family, so he doesn't buy it. Braden owes a hospital $12,000 for a trip to the emergency room, the only place that he could go because he has no health care. Braden's brave, though. In his letter, he doesn't dread the debt he carries or grumble about how hard he works. But he does fear that, I quote, "If I was seriously sick or injured, I would lose it all," end of quote. Alicia is a 21-year-old woman from Las Vegas. She needs surgery for the kidney disease with which she has suffered since she was born. But because recently she lost her job, health care isn't part of her life anymore. Alicia has done everything she can to try to get help. Medicaid tells her she doesn't qualify because she isn't pregnant, doesn't have children, doesn't have disability insurance. Insurance companies refuse to cover her, calling her kidney disorder a pre-existing condition. Everyone else calls this a tragedy. These stories are as real as they come. The letters are written by people who play by the rules and don't understand why the healthcare system doesn't play by the rules. They're written from the heart, and many are written through pain, tears, and uncertainty. Sadly, though, Mr. President, they're not unique. Many, many Americans like Lisa skip routine medical checkups or, like Braden, live just one accident away from bankruptcy or one sickness away from bankruptcy, or like Alicia, fear for the worst while they fight through the red tape. Our Republican colleagues like things, obviously, just the way they are, the status quo. They've committed themselves to a strategy of misinformation and misrepresentation. Well, misinformation and misrepresentation is not where we should be, Mr. President. This, together with their attempt to delay, is only going to hurt people like Alicia, Braden, and Lisa.